Hello again. The next video we will look at is accidental rodenticide poisoning in a young dog. What is anticoagulant rodenticide? Well, it's a type of rodent poison that blocks the synthesis of vitamin K in the liver. This is a major component of blood clotting. When ingested, when ingested by an animal, it will cause them to bleed uncontrollably without the ability to clot effectively. And if enough poison is consumed, it will cause them to bleed to death, either internally or externally from a wound. Types of anticoagulant rodenticide. There are two types of anticoagulant rodenticide. Type 1 is a cumulative poison. These poisons often contain warfarin and they need multiple feedings to kill rodents. And then there is type 2, which is a single feed poison. These are much stronger and can kill from a single feed. Rodent poison is designed to be really palatable, and pellet poison especially is often mistaken for kibble by dogs. This is why dogs end up eating poison. The case we'll be looking at will be a young male dog that has eaten a quantity of rat poison. The owner has realised within about an hour that the poison is gone and knows the name and type of the poison that it was. Initial treatment at home. As an owner, it is vital to try and give as much information to the vets as possible, as this can save valuable time when treating your pet. If you can, note down the symptoms, see how much poison has been consumed and how long ago it happened. If you have the packaging, bring it with you, as this will tell the vet exactly what's been consumed. If it was recently eaten and you're unable to get to the vets immediately, upon the vet's advice, induce vomiting using a teaspoon of hydrogen peroxide per 10 pounds of body weight and repeat the dosage after 5 minutes. However, this is only to be done on vet's recommendation. How long ago the dog ate the poison and what type of anticoagulant rodenticide was ingested, type 1 or 2, will determine how the symptoms present. Cognitive poisons will often take several days for the symptoms to significantly present, whereas the single feed poisons will show signs more dramatically and much sooner. Symptoms for both of these could include decreased appetite, changes in breathing due to the blood pooling in the lungs from internal bleeding, bruising, pale gums, bleeding from the gums, if the dog's vomits and there's blood in it, blood in the urine, blood in their stool, swelling of the abdomen due to accumulation of blood called ascites. These are all signs of internal bleeding, meaning that the poison has entered the dog's system. At the vets, a vet nurse will collect a brief, accurate history from the owner to help determine the treatment required. This includes temperament of the dog, age of the dog, any underlying health conditions, symptoms noted by the owner after the poison has taken place, types of poison that is suspected to have been consumed, amount of poison consumed, when the poison was consumed. They will then perform a health check, like in the cat health check video shown before. Immediate aggressive treatment is required in poison cases, and if the poison was recently ingested, vomiting should be induced as soon as possible for the best prognosis for the patient. Here you can see a health check on the dog taking place. This is just a basic health check, the same as what was done with the cat in the previous video. After the triage, the dog will be further examined by the vet, and while the dog is examined, a vet nurse or animal care assistant may help with the restraining of the dog. And if needed, restraining equipment like a muzzle may be used. You can see a muzzle and a lead in the picture there. The nurse will restrain the dog to present the cephalic vein by holding the dog with one arm and gently holding out the front leg, pushing against the elbow joint to sort of lock the leg in place so it can't move while the blood is being taken. or an IV is being placed. As part of the preoperative care and further examination, the vet will check the respiratory system. So he'll look for if breathing is compromised, oxygen therapy, if breathing is compromised. If that's the case, oxygen therapy should be administered. They'll check the circulatory system. This is checking the heartbeat with a stethoscope and a pulse rate monitor, looking for tachycardia and things. They'll also look at the mucous membrane colour. They'll check the neurological system. This is mental awareness of the dog, referred to mentation. So this is if the dog is alert and reacting as it would normally do so. Other checks that will be performed will include checking for a raised temperature. A dog's temperature should be between 38 and 39.2 degrees Celsius. This will be performed with a rectal thermometer like the one shown in the picture. And also look for any bruising or bleeding. Any abdominal pain should always be conducted for poisoning. Sorry. And also looking for bruising, bleeding, and any abdominal pain. This should always be conducted for poisoning cases, as these are signs of internal bleeding. A complete blood profile should be conducted, taken from the cephalic or jugular vein, and the area should be shaved and disinfected to avoid any infection. And finally, coagulation time should be tested and an anticoagulation panel is recommended. For poisoning cases, time is important to treat the animal successfully. The vet will induce vomiting and then administer charcoal to reduce further absorption of the poison. The activated charcoal will be given at a ratio of half a gram per pound of body weight. This helps stop further absorption of the poison. Activated charcoal is given orally. If the dog won't take the charcoal, mix it with something they will eat. Charcoal absorption actively will decrease if given with food, though, so the dose will have to be increased by 20 to 30%. Vitamin K injections are given to encourage blood clotting. 2 doses should be given 12-hour intervals at a dose rate of 5 milligrams per kilogram of body weight. The dog will need fluid therapy to reduce dehydration. This will be usually from the vomiting. It is best to give via IV injection using an intravenous catheter. A giving set, fluid bag, infusion pump, IV fluid stand, and cohesive bandage. The bandage is there to hold the catheter in place whilst the fluid therapy is ongoing. If it is severe poisoning, then blood transfusions. This is giving new blood intravenously, and oxygen therapy may be needed. You can see an example of a giving set here and the IV fluid stand, and then the picture of the dog there shows how the bandage is used to hold the catheter in place. Once the emergency treatment has been administered and the dog is stable, it will need to stay in hospital for observations for a few days depending on the severity of the poisoning. The vet will probably give it antiemetics to reduce nausea and reduce the chance of it vomiting again, risking further dehydration. After this, vitamin K tablets will be given daily with food at 5 milligrams per kilo of body weight. Blood tests will continue to be performed to determine when the vitamin K treatment can be stopped, and, if necessary, further blood transfusions may be performed. The prognosis for the patient: if treatment is given within a few hours of ingestion, prognosis is very good, as little poison will have entered the body.